Thank you. I add my thanks to everyone and this panel as well. What we're going to do now is the workshop planning committee will get together and join in some visioning, blue skying about a standardization system that supports a resilient supply chain. We'll reflect on what we've heard over the last 2 days. Again, conversation means means with, and versus means turn. And so as we listen to each other, we may change some ideas. That's part of the idea. And how we can have a streamlined standardization process and how that would look and how we could get there. So this is a perfect follow-on to the brilliant thinking we've just had. And I would like to, and Tenor, thank you, special thanks for a superb summary of the last day and a half and so. And I'd just like to add another way of thinking about what we've heard. One is, we now know we have a bountiful supply of hopeful yet tired optimists who are realistic and listening carefully, taking the pulse of the workers and of the public and of the supply and the supply chain. There are those who think that because of the lack of permanent change that's been made in response to COVID, there are some who think that the next pandemic is likely to be a disaster too, although we could solve it. And that gets to something that was just mentioned, leadership. And leadership makes all the difference in many ways. And it is leadership in manufacture, it's leadership in design, it's leadership in the people in the public, it's leadership certainly at governmental levels coming together. And I think about what the National Academy of Medicine is doing right now about clinicians' resilience and well-being. And bringing together a collaborative across all of those groups as well. And so it's not just one kind of leadership, it's many kind of leaderships who want to gather to do the right thing. I'd also like to make a bit of an asterisk. I think we are all in the same storm. I think that there is a flotilla of boats, however. And the boats have different crews and different equipment, different resources, and we need to stay together as a flotilla and help all the boats rise together. I think that we also all know what's said by AA, and it wasn't said by Albert Einstein, but the definition of insanity is doing the same thing over and over again and expecting a different result. So we're in a perfect position to do things differently, which brings me to one situation, and then I'll get to some to-dos. But it's curious that one of the things that may make our situation different, although we're all in the same storm, we are expecting not just the next infectious trouble, we're expecting the next toxin, and it could be nuclear, it could be any number of things, it could be wildfires and so forth, is that the current shortage of workers that we have in healthcare and other workplaces may be an incentive for employers, for standard makers, and for others to think about better education, think about better equipment, think about even paying more for a good product. Because one of the reasons that people might want to work at a workplace versus another workplace is because, in fact, it is a safe and healthy workplace. So the shortage of workers could be something that we could benefit from in a variety of ways. So a few things in the to-do list. I just mentioned about better products. Barbara DeBon mentioned that, about being open to new things, about education, about thinking about performance versus design standards, because both have benefits. And one bit of to-do could be, how can we benefit from the strengths of both kinds of standards and bring them together, so to make a better overall standard. And also another to-do is to ease the tensions if we can, and it may be, again, rising with the occasion, which I said at the beginning, President Lincoln, in dire circumstances, rising with the occasion to decrease the tensions between industrial hygiene and the medical professions or the health professions, to decrease the tensions between employer and employees, to decrease the tensions between NIOSH and FDA. Those are all things that can be done. And would just say in semifinal that we know that what changes behavior is not knowledge, because a fair number of people still do smoke even though they know it's bad for them. It may be knowledge, but not always. It's not always punishment or enforcement. But one of the things that changes behavior the most is what your peers do, what our peers do, what the people around us talk about. And someone who's willing to make a change, to reach out to other leaders across whatever aisles there might be, or walls or dividers. That's what's going to change behavior, because that's what we need, is to change behavior. I'd also just suggest that there are two groups we haven't, they've been touching on one of the groups of what levers do we have, along with the will to rise with the occasion, and getting leaders to collaborate is one of them, just mentioned that. Social media, most people under 35 don't read much at all, and they certainly do, however, and they don't listen to the radio, they don't watch TV, but they do social media. And so what can all of our groups that we are with and represent do with social media? And finally, the International Day of Women is March 8th. And we know that women make most of the health decisions in this country. And so what kind of force can mothers of children who don't have masks, either one of them have masks, but especially the children? What about mothers who need to have gloves to use cleaning agents with? What can mothers and what can women in general do as a force for making major change in how this system works, how this system of standards, supply chain, PPEs, and good health, that's the system. What levers do we have? And I would just suggest that those are some of them. And so with that, I would like to hear what is boiling on your minds, what is unfinished business, and how we can get into action and make a positive difference in this situation with all of the talent that's represented here and across the country. So I'm open to who would like to be first. I could call on someone, but I bet that someone is boiling.
I'm perpetually boiling. So I will just say, thank you. First of all, I really am a believer and an advocate for safety culture and the importance of sort of the microcultures we create in small situations, and modeling good behavior, modeling safer behavior, and really encouraging people to do things that are in their own best interest. So thank you for that. 2 quick points, and I know there are a lot of people on here who are very smart and have a lot of things to say, but I really loved one of the ideas that I heard in this last day and a half, and that's this idea of needing a place and a platform for end user feedback. And I think, I really, while I'm not suggesting this is the format, but, I think people got used to the idea of, well, when we were first rolling out the COVID vaccines, was that there was this, a clearinghouse of where you could report side effects, right? So, and obviously that's had been there for a long time with other vaccines, but having some place where people could report their experiences with PPE of any kind, maybe there's pick lists and maybe there's just places for people to enter their information. But I really feel like that is a better movement going forward than the very, I think, well-meaning motivation to say, well, we should have more people who sit on standards committees who are end users. As an end user, I've been a member of ASTM and AAMI for a couple of years now, and I still don't understand them. It's a challenge with the language. It's a challenge with meetings. It's a challenge with the jargon, which is so embedded in that culture that it makes it almost impenetrable for someone from the outside. And that sort of leads me to my last point. Without wanting to sound like I'm making a judgment here, I do wonder if there are barriers to progress that need to be recognized. And by that, I mean, are there people who have, their own fiefdom or their own investment or their own lack of communication or lack of cooperative culture, whether that's between agencies or whether that's just an investment in, people who've worked in standards for 40 years who do understand the way it works, and they really, they don't have a motivation to help it be understandable for other people. And I just, I really think that recognizing those things, whether that's FDA and NIOSH, whether that's, needing funding, I think there are barriers to progress that we need to recognize before we can move past and through those. But thank you so much. This has just been a fantastic experience, and I definitely cede the floor to other very smart people out there.
Thanks so much. Other comments? Carolyn.
Yes, I found it interesting to hear that technology is there for children, for respirators particularly. That was discussed a couple of times, not in our country, no. And so also it's if you can achieve the ability to put a respirator on a child, then there was good information that talked about different ethnicities, different face shapes, women, even, I've helped fit check many young people, and the differences in face sizes and stuff. So if indeed the technology or that work has already been done, but it's not been accepted in our country for whatever reason, how do we move forward with that? Because we definitely have populations that have not or do not currently achieve good fit for respirators. And so I found that fascinating to hear that. I did not know that it existed.
If it's okay if I jump in, a lot of what Jill said sort of rang so true with me. Like, why isn't there a free marketplace? If you don't like the way, Banana Republic pants fit, you can go to Gap, or you can go to, there's all different types of vendors. But the way these hospital procurement teams work, I think it's all price driven. And I think it's very hard for somebody with something new and creative to break into the market. So we have the technology for items to go back for people to give their feedback and say, I would like it longer, I would like it fuller. Why can't we incorporate something like that?
Ping Long?
Yes, thank you very much, Linda. I just want to start by saying that when I first got the invitation from Kelsey, from National Academy staff, I was very grateful because I thought this has been long, long ago. This pandemic, in many people's minds, pandemic has been over. I'm just grateful there's still a group of people who haven't forgot about it. So we are here, of course, because of the challenges we faced between March and May 2020. If you allow me to take you back to March of 2020, so what did we experience in March of 2020? That's like basically a horror movie. I'm just thinking that over the past 2 days, the same horror movie has been replaying in our mind again and again. And I know a lot of things have been said, but one thing I haven't heard is that what can we do next time if the demand increased by 20 or 30 times overnight, right? And so if demand increased by 20 times, do a lot of discussions about the standards even matter? Are they even relevant? And do we have any realistic understanding about what's going to happen, right? But even regardless of standards, one thing is for sure is that if demand increases by 20 times, first of all, we don't have enough inventory, and we don't have enough production capacity either. And I think the worst of all, we do not have the capabilities to ramp up our capacity by 20 times just to match the demand. I'm not saying that to ramp up a capability within 1 day or 2 days, 1 week. I'm talking about ramp up capability within 3 months or 5 months or a year. We just don't have that capability. Reason we don't have a capability is really because we have really done some systematic the great work of hollowing out our manufacturing sector to an extent that this now is hard for us to find enough workers, engineers, quality controllers who know the stuff. I mean, we talk about a lot of standards, but we do not have enough people to understand them, not to mention to actually know all the ins and outs, and to be able to build something in the matter of weeks or months or even years, right? Even by now, we still don't have it. So if you think about it, a lot of discussion here are very broad, but it's fair to say that the shortages of N95 was arguably the most consequential shortage healthcare workers faced. Now, N95 isn't even a new technology. So this was a technology invented about 30 years ago by an engineer at the University of Tennessee. His name is Peter Chang. He's a Taiwanese American who immigrated to the United States. Now, question we have to ask ourselves is that in 2023, can the United States still attract people from all over the world to do the engineering stuff? I doubt it, because if you are not making the stuff, how can we make sure people who actually research this stuff will come here to actually do the kind of research? And there has to be a community of people, community of, like I mentioned, experts, workers, but it's also very important to have management expertise, to have working capital. So I think if that's one thing we have learned from March 2020 is that the United States government can print unlimited amount of money, but you cannot buy the experts, you cannot buy the expertise. You cannot just sell the knowledge to the public. And you certainly cannot just import, the capabilities, right? Inventory maybe, but we do not get the capabilities. So so that's I want to connect that to Linda's keyword about shortage of workers. So I have been boiling while Linda was speaking. So I think this is basically the keyword I want to what I get from the workshop is the capabilities. We have that. I want to make sure when we talk about standards, let's not forget why we are here. We're here because of that horror movie in March of 2020.
Thank you. A profound comment, which leads me also to say something I didn't say at the beginning, that one of the things that really struck me throughout both days is the element of equity, including immigrants, including rural areas, including extra large urban areas, including farms, including small workplaces, large workplaces, places where people don't have agency. It's nice to know, it's terrific to know that OSHA can back you up if you make a complaint. However, if you lose your job and you lose your town and you can't stay there anymore, then having a federal agency is kind of cold comfort. In addition to what you've just said, Tinglan, I would just say we all are vulnerable. We all are vulnerable in one way or another. Again, some have more resources and equipment on this flotilla of ships, but we need all the talent that we can get and use. I just wanted to read, because Stephanie has
my sound issue just resolved,
Yay,
actually. So Linda,
great.
I'll say it myself.
Go girl.
Apologies. Yeah, I think one of the key issues that I've heard repeatedly over the last couple of days is the need for flexibility in our standards. You know, that came up in the design one in terms of flexibility for a broader range of designs, but it also came up on the conformity assessment one earlier, right, talking about the need for some flexibility in the ways that we could adapt our conformity assessment processes during emergencies and, you know, during future pandemics and those sorts of things. But I think, you know, to Jill's point about barriers and sort of ways that we get stuck in older thinking, I think it's possible that we need to think through again, you know, look at the scientific evidence for how we design things for the public, whether the goals need to be reconsidered. You know, there's been a lot of discussion about the best protection for the public and the importance of making sure that the public has the best things that are available. But, you know, maybe partial protection with good education, so people understand what protection they're getting. If it's easier to use and more tolerable for people, could actually provide a broader public health benefit than the best. You know, respirators are a great example here, right? Like insisting that folks can only use NIOSH certified N95s. Absolutely, right now, that's what we have the best data for. It's what we can give people the most confidence in, right? But there are some folks that don't tolerate those well. And so, you know, if we can get someone to tolerate something that has a partial benefit, there could be some key things there as well. And I think we just need to make sure that we're considering the goals as well as we think about flexibility.
Amrita, do you have anything on Boyle?
So from me, one key thing that I took away was simplicity. And when I say that, what I'm referring to is, it seems like what we need is simplicity in terms of design of our PPE so that it's intuitive and easily usable across a wide range of scenarios. It is something that can be used by anyone. And what I seem to have picked up is that all our research, all our work into improving PPE, whatever has happened, it's been slow, but it's also gotten things to a point where it's more and more complicated. You need to have this specific standardization for this situation. Not everyone knows what they're supposed to use. And our research has actually made things more difficult rather than make it simple. And I find it hard to believe that with the sort of creativity and tech know-how that we have in this country, where we can land a rocket booster back at the exact spot it took off from, and we can invent phones and get the general public to use iPhones, which are expensive, that no one was using 25 years ago, and we can get such uptake into these products, shows me that we're not investing into the creation of better products for PPE, and we're not incentivizing. So there's no incentive from the government, there's no incentive from the consumer. The consumers don't see the value in this, at least not at a large enough level that you have people being able to build a company the size of Apple for PPE and people willing to spend $1,000 to get a PPE.
It makes you kind of want to take a just kind of a big cut through all of the tangle and just open the doors and be able to get some good progress made quickly. I mean, what we heard from Andy Moy is it's pretty hard, and also Michelle, hard to break in, hard to be innovative, and if the standards, understanding the standards because of the language and because of the complexity is difficult, the system is hard to understand as well. Is how can you really, if you have a treasure that you'd like to bring forward or even give or use in some way, how do you find the way to do that? We're talking about a complexity that seems to be stifling progress. Other comments, other headlines, other learnings, other directions?
Can I just ask, Linda, the appetite clearly is within this group to move things forward, but who does need to make some decisions? A lot of this will require funding of some sort, I'm sure, right? So, if we think NIOSH needs more funding, or the CDC needs more funding, or NPPTL specifically needs more funding, or I mean, I don't even know, but where does that,
I think the answer is yes, Jill. They all need more funding.
But how do we encourage that, right? I mean, I don't know whether this is something where there's a congressional subcommittee on, X, Y, and Z that needs to hear this. I guess I worry in some ways about making something maybe similar to some NIOSH studies of their own that have said, look, for the last 20 years, we knew some of these things weren't working. But until there's money to move something forward, all this is good intentions. So, I mean, I'm happy to write letters. I'm happy to poke my senator, but I don't know what really we need to do.
There may be good answers to that. Benjamin Franklin said, nothing ever happens in these colonies unless there's a crisis. And these colonies have had a crisis lately. And so we see some glimmers of hope. And the question is, again, how can we clear the undergrowth and get around the barriers? How can we bring forward the boosters? And it seems as if it's partly a political issue. It's partly lobbying. It's partly, it could be, it's occurred to me that the National Academy of Medicine itself could put some muscle in. Again, it would probably come up with another report, but it has the ear of Congress. The part of the question is who has the power here? Who has the power, and how can that power be put to good use? And when you look at powers in states and in communities and in the federal arena, there's several definitions of it, but one is the public has some power. It can elect people. There are lobbies that have power, and some feel that the insurance company lobbies are some of the strongest. Well, what about insurance companies that cover workers' comp? Maybe they would be interested in saving some money. Labor has lobbies. So there's the whole political element. There's the whole public element. I'd say again, women in particular. And it may be that more use of social media and getting younger people activated as well might make a difference. It may be that the DEI movement is one that can make a positive difference as well. So it takes a movement. It takes a movement. And the question is how to put that kind of movement together. Who's on the boil to put the movement together? It may be the public being worried that there's not going to be very many healthcare professionals left to take care of them. Maybe that's some group that will rise. Maybe it's, again, parents of children. So I'd be interested in other solutions, other answers to your good question, Jill. I
Linda,
would say everybody into the pool. Yes.
I wondered, I think that I like the idea of the movement, and I know that movements can be powerful. I've been part of those and making very positive changes. And we currently have a lot of good stuff now. I don't think we can forget that. I think that it was great to hear from Andy that was in my panel or in my session about all the stuff that Ocean NIOSH is currently doing to improve the educational materials that they have. So is there a way to tie a movement with what we have? I can give an example of when I teach my college ag students and I teach about PPE. And if there's one place I can send them, and they really are change makers too, to say, we also in this country are looking to have a resilient public health supply chain that will impact you. Here's some place you can go to help us. Here's a link, or here's some social media that we're going to do. Can you tag us? You know, I think that in providing good education with what we have now, there might be a way to also move forward to where we want to be. But we're not stagnant. We're moving forward. We're educating. We're providing good information, but we're getting someplace else in the midst of that.
Well, part of it also is just be on the look for the good things, just as you said, Carolyn, be on the look for the good things. We've got package, we have good things, we have awareness, which is the first step in any kind of change. We have good people, we have expectations of a tremendous need ahead. So there is a lot of good going on. The question is how to glue that into the movement with leadership.
I think we do need leadership, Linda. I think we need government support and funding that backs the local regional industrial base that manufactures PPE. And they could do it in a lot of different ways. It doesn't have to be just buying PPE in the US. They could offer, you know, tax incentives to domestic manufacturers. I mean, I think there's all different ways of getting that done.
And so back to the practicalities of who has someone's ear, who knows whom. That seems to be what moves things in a political framework.
And I would just say, Linda, I think the other piece that we hear a lot about is we don't have workers. People are quiet quitting. People are loud quitting. People don't want to work. Well, maybe if we made the workplace safer, people wouldn't mind working, right? So what I hear when I complain about PPE is, well, people need to reach out to companies and tell them what they want. And you need to demand more, and you need to look at the specifications for these things. And I think that we need to shift some of that from being the responsibility of the worker to being the responsibility of employers, to say, look, if you want workers, you're going to have to make this a safer place. You're going to have to find PPE that works for them. And that means increasing the number of extra small gowns you buy, or extra large gloves you buy, or whatever it is that meets your workforce's needs. And I think we don't have a safety culture right now. We have, unfortunately, a culture that says that employees are disposable. And that's certainly how frontline workers felt during COVID. Frontline workers of every kind, right? Your delivery workers, food workers, retail workers, healthcare workers, teachers, everybody felt like their lives didn't matter. What mattered was keeping the big engine going or making somebody else happy. And that's not an easy place to recover from. So I think we have to say, you know what? Our economy runs on human beings and we need to value them. And part of that is valuing their safety. And we recognize our past and we're going to step forward with a better safety culture.
That leads right into Daniel Gerard. Would you mind speaking up what you've texted? Are you there?
Yes, I'm here. I'm here. No, I think that we need to approach this from the standpoint like we did with the Marshall Plan, and that, we have an opportunity to retool, rebuild, refund NIOSH, the MPPTL, all these different initiatives as we move forward. There is if we applied the same resources and the same energy that we did at the beginning of COVID, I mean, I don't want to say we lost steam after we came up with the vaccine, but we built up to that point. Imagine if we applied that same energy to HIV. What we would have did and what we would have accomplished, in a 2 to 5 year time frame. We have tremendous resources. It's not only about the PPE. It's not only about the things that we wear, because emerging threats will always find a way to circumvent what we have. But it's the resource, it's the research, technology, and science that is that has such a critical need to be funded. And, we need to be able to have those tools so that when we need to spool up and address a threat, they're there and they're ready for us.
Well, it's having that good basic material, just as you had said, and then it needs to be communicated in a way that's acceptable to people who would be using whatever it is. And then again, completing the circle, we need to get their reactions to it so that we can then make the changes because there's a difference between, the laboratory and the field. So all of that, we have it. It's just as if we need to have that spark. Ting Long, are you boiling back again?
Yes, exactly. So I was going to just to amplify what Jill just said, and also Daniel just said. The point is that we have to put enough resources. I fully agree. We need respect for people, make workplace safer. That's 100% agree with that at macro level. Macro level, really, this is about spending. So this is about spending game. We really need to see real money spent in the US manufacturing and in the R&D. So if you look at research development, US used to lead the world by great margin, but not anymore. Certainly not anymore, especially when you consider cost of living. US is no longer the most generous country on earth in terms of funding resources. It's getting very difficult for engineering professors to get funding. Not many people want to become engineers. Not many people want to become engineering professors. I was trained in engineering, but I didn't become an engineering professor. So the point here is that United States must outspend any other country, if not overspend. I think I'm looking at the National Science Foundation funding has increased, NIH funding has increased, and President Biden, but just not enough. Even if we're doubling, tripling the funding, it's still very, very, very little compared to all other government spendings. And this is very, very high return on investment kind of spending category. We should absolutely see a lot of real money be spent to nurture domestic manufacturing, R&D labs, university labs, because this is really about capabilities, right? All the money spending is eventually go to people who will be doing research, who will be actually doing design, doing the actual manufacturing. Even though right now, US does not have a cost advantage yet, but it will if we keep spending, keep investing. There's no way, there's no reason we have to be high cost in the manufacturing category. That's really the reason, only reason the unit cost is higher is really because we have ignored, we have dismissed the sector for too long. Then you look at the other countries, so-called developing countries. Now they are leapfrogging. They have moved to more automated, more environmental friendly kind of manufacturing technologies, and we have been left behind. We have been actually left out the game completely because we're not in the game. So I think the big picture, I really think, just want to amplify what Daniel just said. We need a Marshall Plan. If a Marshall Plan sounds too old, we need the Operation Warp Speed to really to make it happen.
Thank you, Ting Long. Just from my perspective, we've been working on solicitations with HHS that have lapsed over a year. I have 80,000 square feet of manufacturing space, and they say the orders are coming, but we pay rent, we built manufacturing space, we created a biodegradable PPE gown that costs 40 cents more than what hospital chains are buying. They just don't want to invest in something that's better for the environment if it's more expensive.
Well, one of the things that I wonder is back to the communication part of it. If the American Nursing Association knew about it, or if the anesthesiologist knew about it, or SEIU knew about it, and that may be wedges. Those may be wedges into the thinking of people who may not understand the field. Victoria, if you're still there.
I am here. I'm here. Thank you. So I'm thinking about next steps and what should be a first priority. And OSMS always thinks about what are the resources that we have? What is the information that we have? That's how we created our medical supply guide, create our supply categories. We gathered all the standards we could find. We put them in there to help guide the manufacturing grassroots process. And each design in our library is not something that's static, that appeared out of nowhere. It is the representation of unbelievable work and community interface that our distributed manufacturing community had with hospitals and users of enormous variety. And OSMS is the only organization that has captured all of that community interface that we're talking about right now on such a broad level, from ICUs, LTCs, public, BIPOC users, really, really broad. And my proposal is that we take the design that we have, the end user data that is created, that is attached to the design. We take our packages of designs in each supply category, face shield, gown, etc. And we analyze these and we streamline them into one design. Because one of the things we found is that our fabricators had such a close relationship with hospitals that they were designing PPE that was more comfortable for the end user and that they liked better than bulk shipments from their normal supplier. And they would save that PPE and use it more often because it was more comfortable. Lots of wonderful things happen from these relationships. So I propose that we create a project where OSMS could put together stakeholders in the university system who created some of these designs, some of which are hosted on the NIH 3D Print Exchange. And we take all of these advantage points of each design and you create one design. We create one gown that can be made cloth or SMS or plastic. And we make a full manufacturing tech pack, and it is publicly hosted on the NIH Exchange. We create a mask and we show the testing procedures. Everything's transparent. That get this as a package that if we need to emergently make, we don't have 10 different manufacturers all trying to find $1.5 million and 2 years of time in a pandemic to get into manufacturing rapidly. If we can save our manufacturers steps, if we could have publicly accessible designs that we know are protective, that would save everybody a lot of time. And OSMS was able to move so quickly because we had so many stakeholders working with us. And I'd like to keep that energy going because I still have relationships with all these stakeholders. I just got off the phone with Jeff Lipton, who was at University of Washington and now works at Northeastern. And we went through a whole Google Drive of designs that University of Washington developed. Really amazing innovations that need to be elevated and recognized for the public good.
All absolutely excellent. It kind of brings up one of the challenges that I mentioned at the beginning of today that's been on, I think, on all of our minds is the standards themselves and the differences between performance standards and design standards, and how that might be addressed. And I was thinking about, because companies, I would think, would like to have design standards, and many other people in the field would like to have performance standards. And I was trying to think of a comparable situation, and I was thinking about batteries, flashlight batteries. There are many makers of flashlight batteries, but there's AAA and there's AA and there's whatever. They all fit into your gizmos. And so there must be, there's kind of a combination of a design standard, which is what size is this going to be, and a performance standard, which is when you flip the switch, does the light come on? So there must be ways for the two kinds of standards to, if not meet in the middle, at least share some interest, because there's benefit to the public to have both kinds of elements working. And I was seeing, I think that Mark Shirley, I think, has left, but I think that he had some thoughts about that too. Does anybody else have any thoughts about that performance versus design standards?
I wonder, Victoria raised a good point yesterday about making sure that the way that certification happens for different products is related to what the actual design of the product is, and not sort of who the company is that's making it. And I think, one potential strategy could be to have performance standards, but within those standards have the ability for specific designs to be able to be certified sort of separate from the entity who's making them. Not that that would be the only way to do it, right? There's certainly manufacturers that need to be able to preserve their ability to make their own designs, but so that folks who are making these open source designs like Victoria is describing could also have a way that design could get certified. And even if it's, there's lower confidence because, we can't then guarantee that the people doing that manufacturing are meeting these guidelines, the public needs to know that there's lower confidence, but still to be able to say this design, if made well, should provide this amount of protection. And I think that's tricky because it's, who's then going to do the legwork to go through getting those designs approved if someone doesn't have a commercial interest?
Yeah, I guess oh, sorry.
Go ahead.
I was just going to say, I guess I'm not sure I completely grasp, even after these 2 days, where there's perhaps necessary divergence already of these two ideas, because I think of like a gown, for instance, just to take an example that's not an N95, right? The new PB70 standard, basically an isolation gown has protection on all of its surfaces. A surgical gown has critical zones. Well, first of all, that's not well known in fields, right? People don't get that there's a difference there. But if you said, okay, so this is the definition for this item, and then we've got these layers of protection or these levels of protection that have to be met in order to meet the standard once it's produced. What is the design standard? Is the design standard saying basically just that if you make a isolation gown, no matter what shape you make it, it has to have the same level of protection all the way around? Is that what we mean by a design standard? Because I'm just not sure I'm getting always the crux of that.
I mean, you want your isolation gown to always meet PB70 standards, but some are made in polypropylene, some are made in SMS. Like there's all different designs. There's over the head and thumb loop, or there's full back coverage with additional ties added in, or, ties built in. You want it to offer you the level of protection. And so you as a healthcare provider should know that if you're picking something of this level of gown, you're going to be safe, on a one-on-one.
Well, I think it just happens to be a topic of conversation among those who think a lot about standards, which, and I just wanted to bring that forward, is of the differences and the tensions. That's one of them that needs to be resolved. And I think as our time is winding down, I just wonder if anyone else would like to add. I feel an enormous amount of energy that we heard from our participants, both our planning group, our moderators, and our audience over the last 2 days. It's remarkable. I think that we have the right stuff. We have to find it. We have to share it. And then we need kind of the big bang to come in and say, let's get together and do this and do it quickly. And so, again, are there any last comments? I guess I do want to say one of the things that I found most touching was the stories that Daniel told, and the stories that Barbara DeBon told, and the stories that we know from the frontline workers, the people and the agricultural worker, the people who don't have advocates or who are thrust into extremely dangerous situations with not much protection and very little care. I think we need to think about equity and fairness, and again, the communication, the loop that comes back, so that we can learn how to do things better. Any other comments?
And I wanted to just re-emphasize the point folks made earlier about really, needing a systemic overhaul, that we need a broader safety culture just for our whole society, right? That it's not a workplace safety culture, it's really a societal safety culture, and that we have a responsibility, to share the knowledge that all of us have and to do what we can to make sure that these standards are promoting that safety culture for our whole society. I like to joke that even for people who don't think about children very often, right? I'm a pediatrician, but my kids that I'm concerned about are your workers in 5 years, in 10 years, in 15 years, right? Like these are the same people, in the same way that the pregnant person, out exposed to wildfire smoke, off the job, is then also the pregnant nurse working in healthcare the next day, right? These are all of the same folks. And so we need this sort of larger systemic overhaul. And I think, to me, that's one of the shocking gaps, that still at the end of 3 years of pandemic, we don't have a governmental organization that has the authority and the mandate to make standards for all the PPE for all people. And I think absolutely funding needs to follow, but to my mind, that's really the key thing that needs to happen, is that that authority really needs to be established clearly. And that's what'll help promote that resiliency in the supply chain.
Thanks. Colleen, if you could make the last comment, and then I'll make the very last comment. Colleen, are you there?
Hi, I'm sorry.
Yeah, it's
I
okay.
just jumped back on trying to do wildland firefighting standard today as well. I just wanted to let everyone know that I think the topic of design versus performance standards has been discussed. And I didn't get a chance, in any of the sessions to mention that the ISO standards that were developed under Technical Committee 94 SE 15 are the most recent standard development effort, right, in terms of trying to create a harmonized standard for all types of respiratory protective devices. And this effort started in 2002. And all of that discussion and all of that effort from experts from all over the world, including ourselves here in the US, really settled on the fact that standards need to be performance standards when possible and not design standards, because design standards are very limiting in the long run. And I think that's one thing that, we've been, dealing with. People think that our NIOSH standard, which is a minimum performance standard, is design restrictive in some cases, and it's not. And I want us to be cautious about thinking that the answer is a design standard, because sometimes that can put us in a box that we didn't realize we were going to. So that's all.
Well, thank you. That's helpful. I think that was not the intention. That's certainly not my intention. I think my intention was to solve it. And if it sounds as if that's well on the way of having that solved.
Well, unfortunately, the ISO standards started from the fire service perspective. So they started with the hardest thing first and kind of got down. So they ended up being rather complex. But I think if the international community could come back together, to be thinking about that minimum level of protection, maybe we could have some good consensus for a performance standard.
Thank you. And thank you for everyone who's participated, who's thought so hard and worked so hard, particularly the staff who's been not only the glue, but also the shining guiding light to this North Star, which is to provide a safe and healthy workplace and home place, because all lives are precious. Thank you so much.